Thank you for joining us for this afternoon's virtual media briefing about COVID-19 in London and Middlesex County. We're glad you could join us. We're also happy to be joined this afternoon by some new guests today. From the City of London, Deputy Mayor Josh Morgan. We also have the Warden of Middlesex County, Cathy Burghardt-Jesson. From LHSC, Carol Young-Ritchie is joining us today, Executive Vice President, Chief Clinical Officer, and Chief Nursing Officer at LHSC, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Welcome to the media in attendance this afternoon, and as always, if you could please, when you submit your questions using the question form here on Microsoft Teams, please indicate your name, your media outlet, and who your question is for. And to those tuning in this afternoon, we say hello as well. Whether you are listening on Global News Radio, AM 980 CFPL, or Rogers Television, as well as the Rogers Facebook page and YouTube channel, or if you are tuning in on the CTV London website. Lots of questions already, but let's get to the opening remarks first. And we'll start with London Deputy Mayor Josh Morgan.
Well, thanks, Dan, and good afternoon. Certainly, we had some encouraging news to report where bylaw officer enforcement is concerned. Over the weekend, officers attended arenas and malls, along with various bars and restaurants along Richmond Row. Compliance was very high. Unlike the previous weekend, only one improper masking charge was laid, and no warnings were issued. The focus now, of course, shifts to St. Patrick's Day on Wednesday. I know City of London bylaw enforcement officers, along with members of the London Police Service and the Middlesex-London Health Unit, will be out in force should any parties be in breach of the COVID protocols. The rules are clear: 10 people max inside a home, 25 people max outside. But those rules aside, it still is not a good idea to be in close contact with people outside of your bubble, especially when alcohol is involved, and when people aren't distancing or wearing masks. Ultimately, and ideally, I'm hoping for a repeat of last year. You might not remember, but literally days after the pandemic really first took hold, St. Patrick's Day was the first major public event or celebration where we asked people not to party and not to gather in large numbers. To the credit of Londoners, but especially those at Western and Fanshawe, we had no issues whatsoever. People listened, they made smart decisions, and we avoided any outbreaks. That's what I'm hoping for again this year, and I'm choosing to be optimistic. So we've done it once, and certainly we can do it again. With that, that's all I had today, and I'm happy to throw it over to Warden Burghardt-Jesson.
Great. Well, thank you very much for that, Deputy Mayor Morgan. It's great to be with you this afternoon. It's hard to believe that we are just about to mark the 1-year anniversary of the states of emergencies being declared by the county and our municipalities. Where has the year gone? In many ways, the year has flown by, and in others, it seems like time has stood still. As I prepared for today's briefing, I reflected back on the many messages I have shared with you over the past year. We have made it through the year with much sacrifice and hard work. I'm not going to rehash the stressors. We are all well aware of them. There have been many positives. Collectively, I think we have all come to appreciate the things that we have taken for granted without even realizing that we were taking them for granted. Coffees and drinks with friends, hugs with grandmas, our classmates, our coworkers. We have come to understand essential workers. Where would we have been in the early days without our grocery store clerks, our truck drivers, our food suppliers, and of course, our healthcare workers? So many sacrifices, and the stories of burden, well, what heroes they are. For some of us, they were the ones who held the hands of loved ones as they passed, held phones up to their ears so that words of comfort could be shared. In the early days, the mantra, "be kind," seemed to resonate with everyone. On more than one occasion, my husband and I have both reflected, why does it take something like this to happen to remind us of something so basic? Let's hope that the mantra, "be kind," when possible, remains with us, because it is always possible. As mayor of the most Irish community in the county, I want to take this opportunity to remind everyone that for 2021, the best way to celebrate St. Patrick's Day is virtually. I know it isn't as fun as gathering for Irish stew and Guinness and green beer at your local Legion or community center, but this year it is the safest way to celebrate. Please continue to do your part. Just because vaccines are rolling out and there are more shots in arms, just because our case numbers for the most part seem to be manageable, what we have learned this past year, things can turn quickly. Act responsibly, if not for your neighbor, for yourself, and for your family. So as we celebrate St. Patrick's Day this week and reflect on the year that has passed, this seems like an appropriate Irish blessing to share with you. May you live a long life, fully of gladness and health, with a pocket full of gold as the least of your wealth. May the dreams you hold dearest be those which come true, and the kindness you stress keep returning to you. So happy St. Patrick's Day. Celebrate well, celebrate safe. And with that, I will turn it over to Dr. Mackie.
Well, thank you very much, Warden Burghardt-Jesson. That is truly a much appreciated St. Patrick's Day blessing. I also want to thank the Deputy Mayor, Councillor Morgan, as well as Carol Young-Ritchie for joining us today. Your presence is much appreciated. So just 11 cases today, no deaths yet again. So once again, we're seeing the case counts and the death counts separate, which is exactly what the vaccine campaign is meant to do and what it's doing. That's tremendously good news. Now we have had the first doses of the the Moderna vaccine come into our community. Those will be going out this week, primarily through the new clinic, which is opening up this week, North London Optimus Centre. We're very excited to have that clinic up and running as of Thursday of this week. And all of that means that we have over 2,000 appointments, which we've been able to add to the appointment booking system for those primarily over the age of 80 or healthcare providers, anyone in the very high risk or highest risk groups of healthcare providers. So those appointments went online this morning. They're already starting to book out. So get them while they're hot, folks. That's the main news for me today. I'm very happy to turn to Carol Young-Ritchie to speak from the LHSC perspective.
Thank you. Good afternoon, and I appreciate the opportunity to join today's briefing in lieu of Dr. Duclos to provide an update on the COVID situation at London Health Sciences Centre. On Friday, an outbreak was declared on the 4th floor medicine unit at University Hospital. The outbreak currently involves less than 5 patients, less than 5 staff, and 0 deaths. We want to assure our community that we are doing everything that we can to contain and resolve this outbreak. We do not want, nor do we expect to see a repeat of the outbreak situation that occurred towards the end of last year. In addition to the enhanced outbreak and precaution measures we have had in place since November 28th, such as limiting staff and physician movement across the medicine units and facilities, over the weekend, LHSC has completed prevalence screening of patients and staff of those on the affected unit, and the medicine patients who were identified of high-risk exposure have been moved to private rooms. While we regret to be reporting on a new outbreak, it's important to note that as a whole, the total number of COVID positive cases in the hospital remains low, with 8 inpatients in total. Our emergency departments are open and safe, and we would ask people to not delay in seeking emergency care if needed. We have been battling this disease for over a year now, and we appreciate the impact the pandemic has had on everyday life. But now is the time not to give up and to relax. It remains crucial that as we see restrictions lessen and vaccine availability widen, that everybody continues to follow public health guidance to limit the spread of COVID-19. To ensure the safety of all those in our community, please limit social interactions, physical distance, wash your hands, and wear a mask when you're around others outside of your immediate household. Thank you.
Thank you all for those opening remarks, and we have a lot of questions to get to, so let's get to them right away. The first question is from Steve Young at CTV London and News Talk 1290 CJBK. It's for Dr. Mackie and also for Deputy Mayor Morgan, and I think, Madam Warden, this one would be for you as well. St. Patrick's Day is this week. There are lots of people concerned that cases could spike if people don't practice social distancing. How concerned are you that this could happen, and what is being done to try to prevent it? I know we've mentioned it a bit in the opening remarks, but I'm wondering, Councillor Morgan, if you want to start, and then we'll see where it goes from there.
Yeah, absolutely. As I said in my opening remarks, I'm optimistic that Londoners and our community can do this again. The issue will arise if people don't follow the public health protocols and if they make unsafe decisions. And I'm confident that people are going to choose to do the right thing, and we're going to avoid any sort of unnecessary outbreaks related to St. Patrick's Day. But that's going to require, for yet another year in a row, the diligence of Londoners and our community members to make really smart choices. And, the Warden said the best way to celebrate is virtually at home. That is absolutely true. And hopefully this is the last year that we're going to have to do St. Patrick's Day this way, but it is certainly a necessity given where we are in the pandemic. So I'm very optimistic that Londoners will do the right thing. And so hopefully it will be a smooth week.
Thank you very much. And I think it makes sense to go to the Warden again, who is looking very Irish and ready for Paddy's Day this afternoon. Madam Warden, how concerned are you about what could happen if people don't follow the public health guidance for St. Patrick's Day?
Thanks for that, Dan. I think what I said in my opening remarks, things I think we've got handled quite well right now, but we know how quickly things can turn with the smallest of get-togethers. I, like Councillor Morgan, do have faith in our community. We have shown that we can rise to the challenge of holding ourselves back, finding creative ways to celebrate these meaningful holidays and celebrations throughout the year. And I have faith that that our residents will continue to do that. I've already noticed that so many restaurants have already, pivoted to encouraging takeout, to, celebrate with your family, your bubble that's at home. Come and you can take out an Irish meal from a local restaurant, take it home, celebrate there. So I see all of these as encouraging signs that our residents will adhere to the protocols that are out there. I think what we've got going for us is that St. Patrick's Day is during the week this year, which is a plus. And students, of course, are getting ready for the year end. So, of course, they'll be diligently studying, I'm sure. But I think that we've got a handle on how we should behave, and I do have faith in our residents.
Thank you, Madam Warden. Dr. Mackie, anything to add?
Sure, Dan. I would just add that, we've also got the weather on our side. So keep it outdoors, keep it small, avoid any indoor gatherings, and certainly large indoor gatherings. If those occur, they will certainly spread COVID.
Thank you all very much. Quick follow-up question, and Mr. Deputy Mayor, I think this is probably for you. Steve Young would like to know if there will be an increased presence with police and bylaw to deal with possible overcrowding on Richmond Row.
So the answer is yes. We're planning for this day. Both the London Police Service as well as bylaw will be available to basically deal with any situations that arise. But as I just said, listen, through the hard work of our community, we earned ourselves a trip back into Orange, and the last thing anybody wants is for St. Patrick's Day to push us back into a more restrictive framework. So, I think people, although we'll have our bylaw officers in London Police Services, and I know the health unit will be ready, certainly, hopefully, those are just precautions that won't be necessary.
Thank you very much. Next question, we're going to stay on the St. Patrick's Day theme a little bit. Rebecca Rodriguez from the Western Gazette has a question for Dr. Mackie. The question before was, are you concerned? Rebecca is asking, given St. Patrick's Day is this Wednesday, would you encourage bars and restaurants to limit capacity or even prohibit in-person attendance on that day?
Well, I mean, we are still under the orange level of restrictions, which does have indoor limits for restaurants. 50 is the max total in a restaurant, no table larger than 6. So these will be fairly helpful protective factors. I don't see a need on that day to go above the current restrictions. However, as Councillor Morgan has alluded to, there will be enforcement to make sure that facilities are not operating unsafely, regardless of what the actual capacity limits are.
And Dr. Mackie, you mentioned before that large gatherings do have the potential, again, to be spreader events for COVID-19. And Rebecca did have a quick follow-up asking whether or not the health unit expects to see a rise in cases after St. Patrick's Day.
Well, so over the past year of this pandemic, we did see a major impact of the Christmas holidays. Other than that, we have not seen significant impacts of Mother's Day, Father's Day, any of the Halloween. All of those we worried and we messaged and people responded and really did the right thing. So I am hopeful that we won't see a dramatic impact of St. Patrick's Day. Now we are seeing gradually rising cases locally and across the province. So in that sense, yes, we do expect to see cases go up, but I'm quite hopeful that we won't see a major spike related to St. Patrick's Day.
Thank you very much. Let's move to the next question, Dr. Mackie. This one is coming to us from Jennifer Beeman at the London Free Press. Dr. Mackie, do you have an update on the outbreak among Western students? How many cases are linked to the outbreak, and have any variants been detected among the outbreak cases?
Yeah, we sure do have an update. Thanks for asking, Jennifer. So we actually have as of today, 45 cases associated with that outbreak in off-campus partying activity. The count was 22 when we shared it last Thursday, and the majority of those additional cases, at least 26 of the additional cases, have come through secondary contact. So people that didn't attend the main event, but were in contact with one of the people who did since the event. So that outbreak, is still growing in number, and we're hopeful that what we're doing mainly is documenting spread that has occurred, because we certainly have given guidance to the people involved, and all of the indications we have are that they are quarantining.
Thank you very much. The next question comes from Ryan Payette at the London Free Press, and I know that Ryan had some questions last Thursday about the OHL, and this is another hockey-related question, Dr. Mackie. There was a skate held at Budweiser Gardens Saturday for OHL draft prospects, 15-year-olds, that included a number of kids from the Toronto area and other red or gray zone health units. There were a number of OHL scouts there to evaluate. I just want you to clarify, at this time, are athletes allowed to come in from other areas of the province and participate in these type of activities while Middlesex-London is in orange?
Yeah, so there are a few parts to the answer. The short answer is yes, this is not currently prohibited. The only travel prohibitions that we've had in Ontario were during the stay-at-home order period from end of December to about the beginning of February. Other than that, we don't have any orders that legally require people to stay in their home jurisdiction. And it's highly discouraged that people travel from low to high or from high to low areas of spread, but at this point it's not prohibited. The municipal facilities in the area have reached out to us, and in discussion with the health unit made the decision not to offer bookings to organizations that are in those higher spread areas, and credit to them for making that decision. But it isn't something that's prohibited, and I understand that others are making other decisions.
Thank you very much. Next question is from Jennifer Beeman at the London Free Press. Carol, this one is for you. How did the outbreak in the medicine unit at University Hospital originate? Was it patient-to-staff transmission or staff-to-staff transmission?
Thank you, Jennifer. At this time, we're laser focused on continuing the actions that will contain the outbreak, and we've been on that all weekend. While it's important to understand the nature of the transmission so we can adjust our controls and practices and to prevent further outbreaks, we know our staff did not come to work symptomatic, and we are not seeking to place blame on any individual. Managing this pandemic is a collective accountability, and one that LHSC staff, physicians, and also our community will be working with to resolve.
Thank you very much. And a follow-up question from Jennifer Beeman, Carol. How many LHSC staff have received at least one dose of vaccine? Are you hoping the number of vaccinated frontline staff will help limit the spread of the outbreak at UH?
But we do know our staff self-report to us if they've had the vaccine, and we do know the number of staff who've had their first dose: 489 physicians, 504 residents, and 3,049 of our staff have received the first dose.
All right, and thoughts, are you hoping that number of frontline staff who are vaccinated may help to limit the spread of the outbreak at UH?
Yes.
All right. Let's move on to the next question. Dr. Mackie, Jane Sims has one for you. Dr. Mackie, do you know how the province figures out the allocation of vaccine doses for each health unit? Do you have a reliable count on how many doses are earmarked for Middlesex-London? I recall several weeks ago you mentioned reallocating doses to other more hard-hit regions. Is that still happening, and does it affect our vaccine supply?
Yeah, so the allocation right now at the provincial level is based primarily on population. So, you know, the province gets a shipment of, say, 400,000 Pfizer doses. They're going to divide those by the proportion of population for each health unit. We have not been asked to reallocate vaccine from this area to other hard-hit areas. The hard-hit areas have been actually further ahead in the vaccine campaign because they did go get many of those earlier doses. And so it's actually areas like us that are now given the opportunity with additional supplies to catch up to those other communities. And we're given a fairly reliable estimate of vaccine flow over the next 2 weeks. We're given estimates for a third week for planning purposes, and then a fourth week best guess sort of estimates. So that's the horizon that we're looking at. And, you know, at this point, we do have a new clinic opening up, North London Optimist Centre, on Thursday of this week. We at this point have had to delay the opening of the fourth clinic at Earl Nichols, which we had hoped would be by the end of this month. But at the moment, it doesn't look like we'll have enough vaccine supply to open that fourth clinic. So hopefully that will be able to come to this community so we can get that clinic up and running soon.
Thank you very much. Let's go to our next question. So this is a question from Rebecca Rodriguez. Rebecca, this is a question I think we've already answered about the updates on the social gatherings and outbreaks. So hopefully we've answered that question for you. Let's move to the next question. Jennifer Beeman at the Free Press for Dr. Mackie. Ontario is expecting a surge of vaccine doses next week and beyond. When will the health unit open another vaccination site? Well, we just answered that actually, Jennifer. That's what happens sometimes.
Yeah, just to add a bit of detail on that. At the moment, the surge in vaccine that we are seeing brings us just back to the levels that we were getting 2 weeks ago. So we were getting twice as many doses for a couple of weeks because of the doses that were missed in mid-February with the Pfizer facility retooling. So, you know, we've been running at that capacity. So there is a surge technically, but, you know, we actually have about twice as much capacity in this community right now to deliver vaccines than we have vaccines coming into the community. So we're hoping for an even greater surge soon.
Thank you, Dr. Mackie. And it gave me a second to read the next question ahead of time so I don't get caught like that again. A follow-up from Jen Beeman. Will the North London Optimist Community Centre be administering exclusively Moderna doses? How many doses will it be administering each day? And how will this affect overall capacity?
So the North London Optimist Centre will be exclusively, MLOC will be exclusively at Moderna as it starts up, and at least for the first couple of weeks. After that, it will depend on whether we're getting more Moderna or more Pfizer in a given week. We'll adjust the vaccine allocations to the different clinics depending on what's available, what's needed. MLOC almost doubles the capacity. So max capacity at Agriplex is about 2,000 vaccines per day. Max at Mount Bridges is 5,500. So sorry, 550 vaccines per day. I saw the warden's eyes light up there for a moment. And then, so 2,000 at Agriplex, 550 at Mount Bridges. At North London adds up to another 2,000. We'll be starting small, about 400 per day, because, you know, that's what we'll have supply for. but that facility can go up to 2,000 vaccines per day. The fourth clinic is the same. It's another 2,000 vaccines per day at Earl Nichols, if and when we have enough vaccine to expand to that facility.
Thank you very much, Dr. Mackie. Sophia Rodriguez from CBC London. Dr. Mackie, what can you tell us about the COVID variants in the region? How concerned are you about this?
Yeah, so the variants of concern are definitely expanding here. We had 7 reported yesterday. Now, that doesn't relate directly to the 11 cases that we reported from yesterday. Those 7 would have been from the past week or so, but they add to the total tremendously. And we had just 4 cases of variants of concern only a couple of months ago, sort of beginning of the year. We now have in the range of, we have 34 confirmed screen positive for variants of concern and 4 confirmed of the UK variant of concern. So that is really taking off. It's becoming an important driver of the COVID pandemic numbers here in this community.
Thank you, Dr. Mackie. Next question is a follow-up from Sophia. Dr. Mackie, is the outbreak at Emdc over? If not, do we know how many active cases there are in the jail?
Yeah, thank you for that, Sophia. The outbreak at Emdc is not officially over. The cases have slowed down there, but we have still seen, a case in the last couple of weeks, which means that we aren't able to declare that over. I'm just pulling up our case management report. I believe the last counts we had were around 50 total cases there, and there haven't been a lot of cases over the last couple of weeks.
I wonder, Dr. Mackie, if it's worth sort of going through what it would take for the vaccine to be declared over, because this is one that's sort of been hanging around and the case numbers have dropped, and it's one of those things, how much longer does it take to declare an end to an outbreak?
Yeah, we basically look for 2 incubation periods without a new case. So an incubation period is about 7 days. And so what you really need to look at is it's not just, when the last case was, it's have you gone for 2 incubation periods without seeing any spread? And that's a sign that the control measures have been effective in that facility. Now, you may have new people coming into the facility who may bring a case in with them, and it can be difficult to tease out whether that was acquired in the community or in the facility. We usually can, based on when the symptoms start and when the person arrives, but that can contribute to an outbreak as staying open longer than otherwise.
Thank you very much. And we are down to our last question. So if you are a member of the media and you've been waiting for that moment to put in your question, now would be the time. So fair warning, I suppose. The last question right now is for Dr. Mackie. It's from Rebecca Rodriguez again at the Western Gazette. Dr. Mackie, regarding the social gatherings, have you identified which fraternities and sororities were involved? Well, Dr. Mackie, you're on mute.
We won't be releasing the names, Rebecca, of the sororities and/or fraternities involved. You probably can get them from the student population, but that would be the level of information that might start identifying individuals. So we don't feel that there is adequate public health justification to do so.
Thank you very much. And that does bring us to the end of our questions for this Monday afternoon. I'd like to thank all of you, Carol Young-Ritchie from LHSC, Middlesex County Warden Cathy Burghardt-Jesson, the Deputy Mayor of London, Josh Morgan, and the Medical Officer of Health at the Middlesex-London Health Unit, Dr. Chris Mackie. Thank you for joining us and for tuning in. We'll be back on Thursday with our next virtual media briefing. So between now and then, have a great rest of your day, and we'll see you on Thursday. So long for now.